Hello and welcome. Today's webinar is COVID-19's impact on travel, shifting multimodal behaviors. My name is Lacey Friedley. I am the Communications Coordinator at Portland State University's Transportation Research and Education Center. TREC leads the National Institute for Transportation and Communities, a university transportation center funded by the U.S. Department of Transportation. NITC consortium members, in addition to PSU, are the University of Utah, University of Oregon, University of Arizona, University of Texas at Arlington, and the Oregon Institute of Technology. NITC's research priority is improving mobility of people and goods to build strong communities. Our presenters today are Yizhao Yang and Rebecca Lewis of the University of Oregon. Dr. Yang is an associate professor at the School of Planning, Public Policy, and Management. Dr. Yang's work focuses on urban sustainability through applied research, as well as community-engaged teaching and services. Her research addresses the relationships between the environment and people's behavior and well-being. Dr. Lewis is an associate professor in Planning, Public Policy, and Management at the UO and the director of the Institute of Policy Research and Engagement. She is an affiliate of the National Center for Smart Growth. She studies land use policy, transportation finance, and the nexus of land use, transportation, housing, and climate change. Today's presentation will be about 40 minutes long, then we will have 15 minutes to answer your questions. During the presentation, please submit your questions via the Zoom Q&A. After the webinar, you will receive an email with a link to the video recording and presentation slides. If you are tracking professional development hours, this webinar is eligible for 1 hour of continuing education credit. A certificate of completion will be posted on the event page within 24 hours after the webinar ends. And with that, I will turn it over to our presenters.
Good morning. I'm Yizhao from University of Oregon, and thank you for joining us for today's presentation. I'm going to share my screen. Can everybody see the screen? Okay, great. You will see the title is a slight difference from what's posted there, but the content all point to how we use COVID-19 pandemic as a way to understand multimodal travel. I'll let my colleague, Rebecca Lewis, to begin the presentation.
Thanks, Yizhao. Thank you for joining us today. We served as the PIs on this grant and worked with a great team of other researchers, of students and faculty at the university. So we'll describe a little bit in our methods about how this grant evolved over time and how we took the opportunity to survey people in 2020 and 2022 to understand the impact of COVID-19 on travel in Eugene and Springfield. So we'll start off with a little bit of background about this project and the general topic that we're studying. We'll describe our research questions as they relate to this grant, talk about our research design and methodology, the ways that we used interviews, focus groups, and surveys to understand how COVID affected people's travel behaviors. And then finally, we'll close with some findings and discussion, as well as policy implications for how to take this knowledge of understanding these behaviors. So thanks for joining. I'll pass back to you, Yizhao.
Great, thank you, Rebecca. So within the planning field and also environment psychology, we have quite a lot of understanding of how environments where we live affect our travel behaviors. And oftentimes we have way to measure and then characterize our built environment and also our perception of the environment, and then how the social aspect of environment affect our travel behavior and adoption of different travel modes. And when we have attitude, this is additional concept comes in, relationship become more complex. This is where we have to take into consideration of how attitude affect people's behaviors, tendency, and how attitude lead to self-selection of environment, which then enables some ones to their predisposed behavior tendencies. All in all, these three concepts, environments, attitudes, and our travel behavior, form this complex network where they could have feed loops from one to the other. And this is where what we wanted to improve our understanding is to think about if we have travel behavior change, can that behavior change feed back to attitudes and our understanding of environment, and then that could further change our attitude, or maybe change our behaviors or travel mode adoptions. And essentially now we start seeing new patterns and new behavior tendencies. So this is kind of the next step of loop and then relationships. And with this conceptual understanding and then thinking this is a possibility, we look at COVID-19 pandemic and sees this as an opportunity for us to test that model and also use quasi-experimental design to understand to what extent if our travel behavior change, and then we understand there's intervention, no specific selection bias because everybody is subject to this intervention. Can we use that as an opportunity to study this potential new model and new feedback loop? COVID-19 is in the past. Now, as we see, the risk of health risk has subsided, and then people more or less come back to their usual behavior. But that 2 years did give us this opportunity to explore more, go beyond just say, okay, there's just a one-time blip. We need to use that as a way to understand our travel behaviors. Existing research have shown that the pandemic-induced disruptions has significantly impacted on our travel choices, travel pattern in 3 travel modes: automobile driving, public transit use, and walking or biking. And then there's a differential impact on driving versus transit use versus walking or biking. Each of these 3 modes have seen significant drop at the beginning of the pandemic, but they were recovered in a different way. Automobile driving, we recover more or less to pre-pandemic level now, and public transit use still lagging. But walking or biking actually, even during the pandemic time, was recovered quickly. Even in some areas, we have seen walking or biking behaviors surpass their pre-pandemic time, even during the pandemic emergency period. So the question is, are pandemic-induced travel behavior changes here to stay? There's just a lot of news outlet and then journalists are trying to contemplating to answer that question. We are trying to use this research project to explore that opportunity, that possibility, and trying to answer this question. But more importantly, we're trying to understand the underlying mechanism where this behavior change could possibly help us shape new patterns and in the future. This is an elaborate framework, basically operationalize the earlier model, and we use measurable data, measurable variables to characterize our environment, our attitudes, and our focus is on when the pandemic interaction comes in, and we see or observe all these behavior changes. Will that behavior change feed back to the attitudes, and will that behavior change affect people's perception of the environment? And if that happened, to what extent those changes then will come back, reinforce this new behavior? Obviously, there's limitation to our study, but we consider this is a rare opportunity that allows to this kind of a research. So ultimately, our research boils down to 3 questions. So looking at how the behavior change affect people's perception of their environment, how the behavior change affect their attitudes. And then because we did the research during the pandemic and toward the end of the pandemic emergency time. So we asked people to anticipate their future travel mode adoption, travel behavior. So there was the effort trying to understand how the people anticipate whether they will drive more, use more public transit, or walk or bike more. So with that said, I'm going to pass back to Rebecca to talk about our research design and methodology.
Thanks, Yizhao. So we focused our research on the Eugene-Springfield area, and I'm going to describe a little bit about the longitudinal research design and what kind of gave us this opportunity to look at the same group of people within two different points of time, and how we relied on surveys, focus groups, and interviews to understand our research. So I'll show a map in a couple of minutes, but we originally received some funding from the University of Oregon Resilience Initiative to do a pilot study of the Smart Trips program in Eugene. And we are on the cusp of starting focus groups to look at how people are traveling to Eugene and this interdisciplinary group of researchers in March of 2020. And then, of course, everything changes. And so we completely shifted gears and decided to completely sort of rewrite our scope and instead ask people about how COVID was affecting their travel, how they traveled before, and the immediate changes that happened after. And so in May of 2020, we surveyed residents around Eugene and Springfield, and we'll talk a little bit more about survey methods later on. But we used a little bit of a sort of social media snowball sampling approach of relying on a bunch of different organizations to post the link, looking at our representativeness, and then relying on Facebook advertising, as well as some other advertising on different platforms to try to sort of flesh out our survey population a little bit more. But in that study, we relied on this interdisciplinary team of research that you see here, where we were relying on some collaboration with business and psychology, as well as a direct connection to the city of Eugene and a great team of graduate students to look at these questions. So we started with a survey in the phase 1 of the research, and then we followed up with interviews and focus groups to better and more deeply understand how people were traveling and what their perceptions and attitudes were about travel. So Yizhao, you can go to the next slide. So I think this actually got cut off. We had a broader list of some of the same people from the last grant. But we then in 2021 applied for NITC funding to be able to do a phase 2 of this grant and to understand how people's attitudes had changed and resurvey the same population that we had talked to in 2020, and ask them, as things were opening up and as people were getting back into routines, how had their behaviors changed. In phase 2 of the study, we approached things a little bit differently. Instead of doing the survey first, we actually interviewed some of the same people we had surveyed to kind of get some ideas about how we wanted to structure the survey questions. We were worried a little bit about recency effect and asking people, to record their behaviors in too many different time periods. So those interviews were really informative to how we decided to set the survey up and the results that Yizhao will be sharing in just a moment. And then we did focus groups after the survey to try to interpret more deeply some of the information we found from the surveys. And we structured those focus groups in both instances to try to organize people modally, so that we relied on their primary mode of transportation to get there. So Yizhao is showing here a map of where Eugene-Springfield is in Oregon, south of Portland, of course, right in the middle of the state on the I-5 corridor. It's Eugene and Salem alternate between the second and third largest city within the state, around 170,000, and then the city of Springfield has around 50,000. So this map is showing you the metro area population by zip code, the number of respondents we had from each zip code. And we'll talk a little bit more about representativeness later on as well. Yizhao, I'll pass it back to you to talk, or do you want me to keep talking through?
Yeah.
Okay.
Go ahead.
So I'll talk a little bit more about methodology. So we were targeting all adults over aged 18 and over living in the Eugene-Springfield region. And I'll come back to this later on in limitations, but we wanted people who had kind of stayed in place during this period. They might have had a job change or a household change or moved or something like that. But we wanted people who had been in this region during that period. That turns out to be a little challenging when you're dealing with a place that has a lot of college students, and we'll come back to that later on. But we were looking at that as our sort of target population. So as I mentioned, our first wave went out in early June of 2020, and data was collected over this time period. We asked about how they were moving around before COVID, so before March of 2020. And then during that shelter in place period between March 16th to May 14th of 2020. And we asked a big sequence of questions around their attitudes about different behaviors and different public policies. So as I mentioned earlier, we recruited through listservs and social media and paid advertisements through some different platforms, trying to get a representative sample of people within the region. Our second wave, oh, sorry, go back.
Oh, sorry.
Our second wave, we wanted to send the survey out around the same time, knowing that Oregon has very different seasonal effects in terms of people's willingness to use different modes of transportation. We wanted to be really deliberate about talking to people at similar points in time. So we sent the survey out last summer, and it went out June to July. We asked about their behaviors during the emergency period, their anticipated changes, their reactions and attitudes to those. But we were really clear about not asking too many different phased questions, because we learned from the interviews that people's sort of memory of those things and their recency effect was really a challenge. So we used that as an opportunity to ask about what they were doing and ask about their perceptions and attitudes, but we didn't try to ask for a really deliberate travel diary, for example, throughout that entire period. We ended up with 384 respondents in total to the second survey, so fewer than the first. 186 of those were from the first survey, and then we did another broader call to try to find some additional respondents. So we have a mix of people that were first wave respondents and who were not first wave respondents within the population. Next slide. So we also, as I described earlier, did focus groups and interviews in both waves. So for the first wave, all of the interviews and focus groups happened after. We tried to focus those around different transportation methods. Whereas in the second wave, we did a pre-survey individual interviews with a different range of respondents to try to understand where they were at that point in time. And then we conducted 3 focus groups after, including 24 of the participants from the survey, to dive in a little bit deeper about some of their perceptions. Thanks, Yizhao. So I'm going to talk about the first wave findings very briefly, and then Yizhao will share some of the longitudinal results and what we learned from the surveys and focus groups after. So our first wave of survey findings, which again, our data collection ended in August of 2020. So some of this is, going to be expected. Travel behavior changed when there was this stay-at-home period. The way people acquired goods, exercised, where they felt comfortable conducting activities changed a lot. And so that was really not terribly unexpected, but what we noticed was that people were willing to sort of try different types of things. They were willing to try biking and walking. Some people shifted their exercise from going to gyms to walking around their neighborhoods and biking in their neighborhoods. But it really mattered whether they were willing to do that based on their perceptions of their neighborhood and the built environment. So infrastructure turned out to be really important to people's willingness to try these different things. They learned a lot more about their neighborhoods during this period by walking around without destination. They learned about their local areas and were spending more time getting out and about. In terms of modes of transportation, these were kind of not unexpected as well. And we see some of these carrying through to the second wave. People were fearful about transit and being around people within an enclosed space. So they shifted from transit to other modes because of that. They dislike sharing in crowded spaces in general, and that affected all kinds of different modes. So they didn't want to bike in crowded places where lots of people were. They also became more thoughtful and planning around trip chaining and how they went about doing different activities. In terms of policies, we saw in this instance, people really liking what work at home gave them. and a desire to work from home, both for safety reasons and convenience reasons. We saw some support for environmental policy. People noticed that air quality improved during this period, and so they were generally supportive of public policies that would encourage people to drive less so that air quality could be improved. In terms of looking at who is traveling differently, education had a large influence on behavior and attitudes, as well as gender and race. And Yizhao will talk about that a little bit more in wave 2 as well. So in terms of focus groups and interviews, that allowed us to dig deeper into why we were seeing these different patterns and why people had these different appetites. And what we noticed was people became more strategic about how they were planning for how they were acquiring goods, when they were going to drive, and how they were going to go about doing trips. So they were a lot more thoughtful about how they were setting up their days. They also made some affordances, barriers, and shifts around each mode of transportation. So they might give themselves like perhaps a little bit more grace, where they would want to bike for all trips in the past, but they decided that they would give themselves the sort of flexibility to order online or to drive to the grocery when they wouldn't before. We noticed this willingness to try new things and some sort of changing behaviors based on what they found. Remember, this was really early on still. So this was in August of 2020. They didn't really know what to expect yet. But as they sort of were asked to go back to work, they returned to some of their previous behaviors and went back to doing some of the things that they were doing. So when we entered into this 2022 survey, really wanted to know what behaviors stuck and what behaviors were sort of reverted back to what they were doing pre-2020. So Yizhao will talk about some of that longitudinal research with repeat participants in the survey and just in general in terms of how things shifted. So I'll now pass it to Yizhao to talk about the second wave from the NITC grant.
Thank you, Rebecca. So the findings I'm going to present here come from two data sets actually. So one of this one I'm showing here come from the general respondents who responded to our second survey, but it's encompassing the smaller subset. Those are the people who responded to both surveys. We include a question in the survey to ask people retrospectively evaluate their reactions to different travel behavior changes. This one is asking the affective reactions, whether they just simply like or dislike the experiences, because almost everybody experienced certain kind of travel behavior changes. What we found out is for driving, generally people's neutral opinion toward their driving behavior change, which mostly is whether they drive more or drive less. But you can see the mirror opposite kind of reaction when people, almost similar percentage of people respond to like the change when they decrease travel significantly. And also people, if they had to increase the change, increase driving during the pandemic time, they dislike that very much. For public transit users, we don't see a big contrast in terms of like or dislike in relation to their transit use level changes. But what is obvious here is people who had to decrease their public transit use dislike it, tended to dislike it a lot. Some of the interviews and the focus group, we found out for people who dislike decreasing their transit use, coming from the reason that they missed the opportunity to have other people to ride the transit together. They missed that social interaction opportunities. For biking and walking, the opposite reaction is more clear. You can see for people who had to decrease their walking or biking or physical activity in general, a majority of people dislike that experience versus people who had the opportunity to increase, they enjoy or like that experience very much. And then we also looked at how travel behavior change correlate with people's perception about their neighborhood environment or environment in general. What shows here is reducing or increasing driving or transit use did not have any significant or clear correlation with how people observe or experience their neighborhood. But for people who were able to use their neighborhood to walk or bike, or just to talk about in general, they walked more, biked more outdoor. There's a clear pattern when people who had a chance to do more of that kind of a behavior, they had indicate they tend to see more people in their neighborhood, feel like they get to know more about their community, their neighbors, and they start finding out more interesting place in their neighborhood, and then they generally feel like they're more engaged. So we also looked at, after this 2-year period, how did people's attitudes and beliefs have changed? And this finding pertaining to the subset of people who responded to our first and second surveys. That's why we have a smaller end here. It's interesting, over the 2-year period, you can see that among the 7 items we look into trying to assessing people's beliefs and attitudes, there are statistically significant changes in people's attitude. People have a stronger belief in driving's negative impact on the environment, and then they have a stronger belief or support to government responsibility or policies to do something, either reduce driving or encourage more EVs, but not necessarily in terms of other policy solution, for example, encouraging more e-bikes. And then they also seems to be a lower belief in individuals' responsibility. Some of the interviews and then focus group offer us some kind of insight into this finding is when people now start having to go back to their previous driving behavior patterns, they more or less feel like it's things out of their control. It's also interesting that people become less confident about their community norm, about how their community actions or beliefs in the environment as a whole. And then we looked at how this kind of a behavior change or attitude change, belief change correlate with where people live. It's very interesting to our folks are interested in find out whether people who live in more walkable places, they tend to have greater changes in their beliefs and attitudes, because these are the 2 very important factors could shape future behavior tendencies and could modify future environment impact on behavior choice. So what we found out here is people who live in neighborhoods with a greater walkability, this is a typical environmental characteristics that we consider is connected with a more walkable place. Their beliefs or attitude improvement seems to be correlated positively with those environmental characteristics. So, for example, people who live in neighborhoods with greater walk scores, they have a stronger, greater improvement in their belief that it's individual responsibility to reduce driving. It's likely because they live in the environment where they have greater control of their choice of travel behavior, and then they are able to realize driving, shift driving to walking or biking because the environment has more supportive or more facilitating. So then we did we used logistical regression to ask people to predict what they would consider their future travel behavior change. The dependent variable is very simple, just whether people indicated they anticipated they will drive more or use more transit use, or will bike or walk more in the future, mostly for commuting purposes or more or for other recreational leisure purposes. So what we found is, in general, the model did not have a very high level of performance. We find very few factors or variables that become statistically significant predictor of their future travel behavior. So for driving, if people started driving more immediately after the COVID emergency period ends. In Oregon, which is April 1st of 2022, they will likely to continue the path to drive more. If they still worry about future COVID or any health risk, that will indicate they're driving less. That's in general less of travel within the COVID time. And it's interesting if people who live in places where have a greater proximity or accessibility to parks, they will drive less. This may indicate they are shifting driving to those recreational sites to use walking or biking there. For public transit use, the same behavioral pattern continues. There is a tendency to continue what they already started or recover to the pre-pandemic behavior, and they will continue that path. And we also, there's a very interesting finding is with people who is already using transit more than they prefer to, they would like to see their lower level of transit use in the future. Walking or biking as an additional two variables that as a predictor, significant predictor that we don't see in the other two travel modes is certain age group tend to consider walking or biking more, and this is particularly what we call the Gen X group, and non-white group. Sorry, that's a reduce their walking or biking, but non-white group, so minority population, indicated that they will likely to walk or bike more. COVID threat plays into their decision. Greater perceived threat will reduce their walking or biking. So to summarize what we find in our findings, first of all, we find very interesting walking or biking related behavior change, how that affects people's perception and attitudes more than the changes in driving and transit use. And that behavior change during the pandemic potentially could influence their future decision to walk for transportation. But the extent of this effect, however, appears to be dependent on the magnitude of the behavior change they have experienced. We also find out as a society as a whole emerges from the pandemic, people are resuming their travel and anticipate increased activity across all modes, including driving, transit, walking, or biking. And this may contribute to the perception that individuals lack control over their transportation choice. And then overall, we've seen a decline in the belief that reducing driving is solely an individual responsibility, and more people think government has to do something about it. The last thing is, while environmental factors have a relatively weak impact on walking behavior in driving and transit, as in our last set of findings about the logistic regression models, but the environment factors may still play a role in facilitating changes in people's attitudes, in allowing people to experience different types of travel behaviors. And this is very much pertaining to the environment where we have more walkable conditions. I'm going to pass back to Rebecca to talk about the limitations and outreach of this project.
Thanks, Yizhao. So I alluded to some of these earlier when we were talking about the methods, but remembering that we pivoted a research project that was going to be focused on downtown Eugene, particularly people walking or working and living there, to trying to do outreach during a pandemic. We ended up sending out our original survey through a whole bunch of different partners and community groups, and relying on the cities and others to share this survey. And as I'll talk about briefly, we ended up with some sort of typical bias that you get from online surveys. So in terms of that bias, we ended up having respondents that were more female, more highly educated, more homeowners. We had an underrepresentation of younger non-white groups, and people that with a lower education status. We tried to use Facebook ads to target specific groups to sort of boost responsiveness in those rates, but we weren't able to really sort of get to what we wanted in terms of matching the demographics of the region. We also noticed in our first survey that we were limited in our respondents that identified as Hispanic Latino or that were Spanish speaking. So while we offered the survey in Spanish in both instances, we didn't get enough responses to sort of match the demographics of the region, which is about 10% Hispanic Latino. So when we wrote the second grant, we wrote in sort of this objective of doing more outreach to the Spanish speaking population. And we tried a lot of different methods. We did sort of in-person, shorter surveys at grocery stores and those sorts of things with Spanish speaking researchers. We piloted a sort of shorter version of the survey, but we really struggled with a survey like this that asked about travel behavior to do really extensive outreach to the Spanish speaking population. And so we want to acknowledge this bias in our responses and the challenges that we faced in outreach. We learned a lot of lessons for future research projects in terms of how we set it up and working with community groups. But the sort of nature of the subject here, I think, made it really challenging in terms of the type of survey that we were doing. So we also want to link back to something I mentioned earlier, which is because we really wanted this longitudinal survey and people that had been staying in this community for 2 years, that made it challenging to resurvey some of the same people. We have college students that some of them moved home during the pandemic, during the time that their classes were online. We have college and graduate students who graduated from school or people that just moved out of the region. And those sort of transient responses made it really difficult to do a place-based survey on behavior during this really volatile period. So that made it challenging for us to resurvey and get sort of the same number of responses. We didn't think we were going to get everyone, of course, but we had a lot of people who said, no, I don't live in Eugene anymore. Can I still fill it out? And that meant that we didn't really, couldn't really do the longitudinal survey that we had wanted because we were surveying people so far apart, which is a sort of common issue in these types of surveys. Yizhao, I'll pass it back to you for our takeaways.
Thank you. So based on what we have learned from this research project, and obviously the data we are analyzing with is already 1 year old. Some of the conversations, we now have a better understanding of how to deal with health risk, but at least when we conduct this longitudinal survey and through the survey data and also the interviews and focus group, it just clearly shows that the health risk has a huge impact on travel in general, and particularly for transit usage. Using policy to build trust through the transparent communication of scientific evidence on risk seems to be very important. The second point that we wanted to emphasize is reducing driving to help people understand its social individual benefits. It's important to reshape people's attitude and beliefs. So public campaign to help people understand that, and also just to let people experience these advantages by letting them drive less, and to significant amount of this shows in our analysis is when people have significant amount of driving reduction, they start really seeing the benefits and to themselves and to the environment as a whole. The third point we'd like to highlight is focusing on the social benefits of travel behaviors. We realized a lot of travel research focusing on just travel being the means to get from one place to another. And then there's a lot of conversation about how different travel modes has environmental consequences. But through our research, we realized it's the social aspect of travel, be it for people who are riding buses or people who walk or bike to destinations, able to meeting people. The social aspect of travel is a very important element to could help people rethink about what kind of a travel behavior impact could on them, and that could lead to different behavior decisions. Lastly, during the pandemic, there's a lot of space that's being made open or made available to pedestrians. This kind of investment is giving very, very positive and favorable impact on people. So continue this investment in pedestrian-friendly public spaces and then also public transit infrastructure. This kind of environment provide enjoyable experience for people, particularly people who not had the opportunity to do so in the past. Having the behavioral experiences could lead to positive attitude improvements, could change their perception of their living environment that's will likely to lead to future behavior changes. I'm going to end our presentation here, kind of on time, there extra few minutes. So I'd like to get questions from the audience.
Thanks for a great presentation. The first question is it possible that the observed positive changes in perception of government assistance and support for electronic cars and e-bikes could also be due to new incentive programs, such as the e-bike incentive program enacted in Eugene and the ones introduced in the state legislature and Congress since the first survey?
Okay, maybe I'll take the first step in this question, Rebecca. Feel free to add more. So overall, we've seen people's belief in the EV as a solution. That belief seems to have declined over the 2-year period. This could possibly attribute to people's concern that EV may not be safe for people as a transportation means. During our focus group and interviews, people constantly brought up this concern that driving behavior seems to be more likely. Some people use the term crazy. The road seems to be less safe. So given that context, that's our interpretation. So e-bike could adding to additional safety concerns.
Thank you. And the next question is related to that. The change in e-bike perceptions in 2022 may be influenced by supply chain shortages and folks' inability to buy. If you have any further comment on that.
So Rebecca, would you like to offer some?
Yeah, I mean, I think it's both those questions are really good points, and as always the case when we're looking at something like this, that there's all kinds of other external factors that are affecting people's perceptions alongside. And so there were new federal programs, there were lots of sort of external factors going on in terms of perceptions about e-bikes and EVs. And so I think it's really important to consider that context as we interpret both of those questions. So difficult to pinpoint exactly what's going on in terms of those questions, but those are really good sort of pieces of background information or external factors to consider for both of those. So yeah, thank you for bringing that up.
The next question is, how have travel patterns like VMT and mode share, etc., in the Eugene metro area changed pre and post pandemic, and do they line up with survey results?
Well, that's a great question. So the data we have, when you look at the VMT change pre and then during pandemic and post pandemic, for the Lane County, usually that's where you get kind of aggregate results. What I have observed is Lane County's drop in VMTs, particularly during the beginning of the pandemic, when you have stay-at-home order, that dropped 40 to 50%, which is pretty consistent with the national average. And later on, the kind of VMT response recover to a certain degree, but not completely because of people still have working remotely at home options. But there's also additional change in terms of the like driving times. I can't speak of Lane County, don't have the data yet, but the research that reviewed is nationwide. What we observed is the rush hours congestion seems to be now spill out of rush hour time because people now have a choice to avoid rush hour time. So there's more freedom for people to come out at different time during the day, although they are accumulating the same VMTs, but the VMT now is spread out across different times now.
And on a related note, did you see any influence on VMT choices due to the startup of Peace Health Bike Share around 2020?
I can take that one. So Peace Health Rides is the local bike share program down in Eugene. And I'll say that during the first wave of the survey, people were not as excited about sharing anything. So their sort of willingness to want to share bikes and be on transit and be in shared Ubers and Lyfts and that kind of thing, our sort of survey respondents said that, they weren't interested in sharing. This is another sort of example of an external factor in Eugene. The other thing that's going on here is that a lot of the student population was either forced to move out of the dorms or they no longer had to commute to class. And Peace Health Rides is heavily utilized by the student population, and the university has a strong relationship with Peace Health Rides and beneficiary pricing for students. So in the period, the 4 terms that students are not taking classes, the Peace Health Rides usage declined a lot. It is recovered. I'm not sure if it's recovered to the previous amount. The same thing is true for transit ridership in Eugene. Students are heavy users of the bus rapid transit system and the MX, and that particularly that sort of stretch of MX between campus and downtown has bounced back, not to the extent that it was in 2019, but we've definitely seen some recovery as requirements for people to be doing things in person have changed. But there's not full recovery yet, or there wasn't in 2022 when we conducted the survey. It would be really interesting to sort of map that data over time and to survey people again now that we're even more fully out of the COVID-19 period to see what's going on in usage. But given when we wrote this report, we don't have sort of current data for the entire year of sort of students being in class. That was really, last year was, so good questions.
All right, well, we have a few more minutes. If anyone would like to add another question to the Q&A box, we can give folks just a few seconds to see if they would like to add any more questions. Meanwhile, thank you for the discussion and for the questions and for your presentation. I do have one question just while we're waiting to see if anyone else has one. I just happened to see this line in the executive summary of the final report. It says, these findings suggest that an approach focused on modifications to the built environment will have limited effectiveness for travel behavior modifications. I was just wondering if you could maybe say a little bit more about what other approaches you think would be needed for that.
Yeah, thank you. That's a great question. I think we began this research with this more or less challenging point to say a lot of our policy interventions focusing on changing our neighborhood, adding sidewalks and improving accessibility. But if you are not allowing people the opportunity to experience the full aspect of behavior implications on collective travel options, then the physical environment impact would be limited. This is particularly true with, we indicated the walking or biking. A lot of people living in the same neighborhood during the pandemic time, the neighborhood condition, the physical condition did not change. All the change was they were needed to go out to as a way to cope with the pandemic conditions, and they had a chance to interact with the neighbors, had a chance to see what's in their neighborhood. Then they start seeing their environment in a different angle or perspective, and then that leads to at least some consideration of continue walking or biking more.
That makes sense. Okay, well, it looks like people are wrapping up their questions, so I will go ahead and say thanks again for a great presentation, Yizhao and Rebecca, and thank you everyone for joining us, and we will go ahead and conclude the webinar there. Oh, actually, a question did just come in. Given the recent severe regional forest fires, did you see any impact on walking or biking?
That's a good question. I don't know that we have, real-time data enough to sort of look on a week-by-week basis, but it stands to reason that there was less walking and biking, particularly in September 2020, and the weeks of poor air quality. And that was still a period when some people were able to continue working from home. It would be really interesting to compare, if we have another few weeks like that, and people don't have this sort of option to work from home, are they forced to go walk and bike, in a subsequent fire? So we didn't track the data that specifically. We weren't looking at that time period as directly in our results, but that's a really interesting question and would be something that would be useful to track in the long run.
All right. We'll just do another few seconds in case anyone has a last minute question. And if not, I guess that does go ahead and conclude our webinar. So thank you again, Yizhao and Rebecca, and thanks everyone for joining us. Have a good day.
Thanks, Lacey.
Thank you.